I will present modeling multiple tests in economic evaluation. The full title is Developing Economic Models for Assessing the Cost-Effectiveness of Multiple Diagnostic Tests, Methods and Applications. This presentation is based on our publication in Medical Decision Making. Here are the outlines. We will provide a detailed discussion and examples for the combination of two tests and a new risk factor in risk prediction. We will also give some brief thoughts on modeling 3 or more tests and a triage test. We will start with the introduction. Novel diagnostic tests improve the quality of healthcare, but at the same time, advanced diagnostic technologies also significantly contribute to increased healthcare costs. The methodology to construct economic models that evaluate a single diagnostic test is well established, typically following the pathway of the true positive, false negative, false positive, and true negative results. However, in clinical practice, patients often receive multiple diagnostic tests. Not surprisingly, decision modeling for a pathway with multiple tests is more complex. In practice, economic evaluations of multiple tests often apply problematic simplistic approaches, such as ignoring the conditional dependence between two tests or assuming a perfect final test in the diagnostic pathway, such as 100% sensitivity and 100% specificity in the last test. Statistical and epidemiological methods of evaluating multiple diagnostic tests have had important developments in recent years. We will discuss how to use these methods in economic modeling. Now, I introduce the scopes of our presentation. We focus on the added value of a new test in addition to the existing tests. We mainly discuss the statistical methods using the published data or aggregated data. Individual patients' data are often not available for the economic modelers. When the individual level data are available, modelers will have more options in modeling. Typically, a new test has 3 possible roles in an existing clinical testing pathway: replacement, triage, or add-on. The replacement test is used to replace the existing test. The triage test is conducted before the existing test. It may rule some people out from further testing. The add-on test refers to the new test performed in addition to an existing test. A single test can be used in different ways in clinical practice, so that we can assign different roles to a new test in the modeling. Traditionally, the focus of a diagnostic test is to evaluate its accuracy. However, the use of tests can be much broader than quantifying test accuracy. Tests can select and monitor treatments, predict the prognosis or risk of a health event, and screen for health conditions. In principle, the evaluation of diagnostic tests should focus on clinical utility, and understand how the actual use of the test impacts patient management and changes health outcomes.